In this lesson, we will address some common questions people have about Chiari, including who gets Chiari, what causes Chiari, is Chiari genetic, is Chiari fatal, and how does Chiari affect pregnancy, athletics, and work? Who gets Chiari? The answer to this question depends on how we define Chiari. As we discussed in the What is Chiari lesson, about 1% of adults and up to 3% of kids meet the MRI definition of Chiari, but most will never experience any symptoms. Therefore, it would make sense to limit our answer to symptomatic Chiari. Although the precise number is not known, based on the number of Chiari surgeries performed each year in the U.S., it is estimated that about 1 in 1,000 people have symptomatic Chiari, or more than 300,000 people in the U.S. alone. Chiari affects both children and adults, and symptoms can appear at any age. But a research study of hospital records found that about 65% of Chiari surgeries are performed on adults and 35% on children. Among adults, there is a large sex disparity, with 75 to 80% of the cases being female. However, among children, it is much closer to an even 50-50 split. The reason for this difference between adult and pediatric cases is not known. There are reports of Chiari cases from all over the world, and it is assumed that Chiari affects all races, but whether some races are affected more than others is not known. What causes Chiari? There are a handful of theories about what causes Chiari, but none have been proven conclusively. The most widely accepted theory is that the skulls of Chiari patients, specifically the back portion, are smaller than they should be, so the cerebellar tonsils end up protruding out. While there is some evidence to support this, the theory also has several problems. Recently, 2 new theories have emerged. One states that instability of the upper spine is the core problem that leads to symptoms, and that the cerebellar tonsils herniate as a protective measure. The second, put forth by Conquer Chiari researchers, holds that subtle instability in Chiari patients leads to overworking of the stabilizing neck muscles, which in turn leads to mechanical failure of the myodural bridge complex, which connects these muscles to the covering of the spinal cord. This then changes the fluid dynamic properties in this region, causing pressure spikes which damage sensitive nervous tissue. Is Chiari genetic? When people ask this question, they often mean, can I pass it down to my children? The answer is, sometimes. There appears to be a subset of Chiari cases which are heritable. Research from the Chiari 1000 database indicates that about 12% of Chiari patients have at least one additional immediate family member who has been diagnosed, and 9% have at least one extended family member with a diagnosis. However, the genetics underlying this are complicated, and there does not appear to be a single Chiari gene. Partly because of this, there is currently no genetic test for Chiari. Another aspect of the genetics issue is whether genes play a role in developing symptomatic Chiari, even if it was not inherited. In other words, are some people born due to genetic variations with a tendency or likelihood to have Chiari? Although the research is limited, one Conquer Chiari study did find that nearly half of adult Chiari patients had a variation on one or more collagen-related genes. However, it is important to keep in mind that environmental factors also likely play a role in developing symptoms, as 1/4 to 1/3 of patients report a specific traumatic event that triggered their symptoms, such as a car accident or fall. Is Chiari fatal? While there are case reports of sudden death associated with Chiari, these appear to be very rare, and in general, Chiari is not considered a fatal condition, and 5-year and 10-year survival rates are not discussed. However, it is not known if Chiari has an impact on overall life expectancy. But given that many adult Chiari patients suffer from high levels of pain and disability, it would not be surprising if their overall health was negatively affected. In addition, recent research from Conquer Chiari has found that adult Chiari patients are at a higher risk of suicidal thoughts and ideation. Unfortunately, social media also indicates that suicide is a real problem in the Chiari community. Finally, it should also be noted that Chiari surgery does entail risk, and there have been reports of mortality associated with it. Can I get pregnant with Chiari? Since Chiari affects a lot of women in their 20s and 30s, it is not surprising that Chiari and pregnancy is the most read about topic in the Conquer Chiari online library. Specific concerns include whether the strain of pushing during labor will aggravate symptoms, the effects and risks of the various types of anesthesia commonly used, and what the effects of the pregnancy itself might be on the Chiari condition. Although there is not an abundance of published studies on the topic, a review of 35 births, which involved a variety of anesthesia and delivery methods, found that, in general, it was safe. About 67% of the women were diagnosed with Chiari before becoming pregnant. 20% were diagnosed during pregnancy, and 14% after pregnancy. About half the deliveries were cesarean. Many of them planned to avoid the risk of elevated intracranial pressure during labor. Although nearly 80% of the women did experience Chiari-related symptoms during pregnancy, only 4 reported worsening of symptoms, and 2 of these cases were women who had not yet been diagnosed with Chiari. It is recommended that anyone with Chiari who is pregnant or considering becoming pregnant should discuss the topic with their physician and consider utilizing a multidisciplinary care team to manage their pregnancy and delivery. Can my child play sports with Chiari? This is a highly controversial subject, and Conquer Chiari does not advocate or endorse a specific view in this regard. Rather, this is a topic that should be discussed in depth with each child's physician, as every case is different. There is not a consensus among doctors on the answer to this question. At a Conquer Chiari research conference, this question led to a heated debate among the neurosurgeons and neurologists in attendance, with some saying for many of their cases they do not suggest any restrictions on activities, while others strenuously objected to this approach and said contact sports should be completely avoided. Still, others said they left it up to the families to decide how important the activity was to each person. In 2023, the University of Michigan published a study involving over 450 pediatric Chiari patients. In the group, there were nearly 6,000 sports seasons played before surgery and 1,000 played after surgery, with no permanent or catastrophic neurological injuries reported and low rates of concussions. From this, the authors concluded that sports participation for pediatric Chiari cases can be permitted in many cases. Will I be able to work with Chiari? Chiari affects everyone differently, so this is a difficult question to answer on an individual basis. However, data from the Chiari 1000 database shows that out of over 1,400 mostly female adults, 54% were currently working, with 75% of those working full-time. But nearly 80% also report that it is somewhat or very difficult to work due to Chiari. 75% say that Chiari has negatively impacted their career, and nearly half have had to change jobs due to Chiari. Among those not currently employed, nearly 80% said it was due to Chiari. Can I go on disability because of Chiari? Again, this is difficult to say as it varies from person to person. Data from the Chiari 1000 database indicates that 32% of Chiari adults pursued Social Security disability, and 45% were successful in securing benefits. In this lesson, we addressed some common questions about Chiari and learned that symptomatic Chiari affects about 1 in 1,000 people. Among adults, females are affected more than males, but among children, it is about even. There are several theories about what causes Chiari, none of which have been proven definitively. From a subset of patients, Chiari appears to have a hereditary component, but there is currently no genetic test for it. Chiari is not generally considered a fatal condition, but patients are at an increased risk of suicide. Pregnancy in Chiari patients can be safely managed by a multidisciplinary care team. For children with Chiari, sports participation is very controversial, but research indicates that it is possible in many cases. Every parent should consult with their child's physician about any physical activity restrictions. Chiari can have a major impact on careers and employment.